Thank you. So without wasting much ado, because I would like all of you all to reach Leva 1 at 2:30 for the quiz. Why is it necessary to have humor and speaking skills? Because understand that many times as you grow older and get more white hair, many patients are coming to you for a second opinion. Many times they're coming because they've been frightened by all the things that the person who has given the first opinion has told them. And sometimes the patient will be frightened by what you are going to tell them. So there is a lot of fear and anxiety in a patient's mind when he comes to a doc. He's come to you because of some problem. So they need to be put at ease. They need to be more receptive to what you're saying. And in the initial phase, there is nothing which separates you from the person down the street. Zero, because you have no experience, you have you're unknown in the area. What will set you apart is your speaking skills, your communication skills, so that the patient will go home and say, this person had a lot of time to talk to me. When I started my practice, I had a competitor who was 30 years my senior and immediately related to me, my father. And he had everything going. He had appointments stretching for 3 months. And I just bribed the secretary, so the secretary would tell the patients that if what are you coming for? You're coming for glasses. Go to this young man. He will spend minimum 30 minutes with you, because I had no other patient. Well, if you go to the senior, he will spend only 2 minutes. He is charging you less. So these are your skill sets. You're charging less. You're got enough time, so make use of those assets. But mainly, your speaking skills will come in first before your surgical skills become known. Explain with examples so that they understand. So come down to the level of the patient. He's not an ophthalmologist. Sometimes we overdo things with our high-tech software, and we have TV screens which show them cataracts and we show them all. They're not following. So give them simple examples. I tell them the eye is like a camera. The retina is like the film in the back of the old film cameras. And if it's somebody who's above 50, I tell them you will understand. And the person who's 20, I said, you may not understand. But in the old days, we had cameras which had film at the back. That back, the film which was the back, that's called retina. So you get a little chuckle from the senior person straight away. So you can use models, color atlases, but the visual imagery that you come out with, there is a lot of scope to put in humor there. Please don't tell patients jokes because they think you've got extra spare time. So there is no joking with the patient. The humor has to be subtle and just come through in your body language and in what you speak. Let's take a few examples. Doctor, is my cataract ready for surgery? Simple question. Now, you don't know whether the patient has gone to somebody else who's already told them that by today evening, 7 o'clock, if you don't operate, 8 o'clock, your cataract will burst. 6/9 vision patient. So he keeps quiet about that. He comes to you, is my cataract ready for surgery? So you keep in mind that somebody may have told him. So you say, you do have a cataract and that's causing your disturbance in vision. Are you ready for surgery? Is it causing you much handicap? You know, if you were Mr. Mukesh Ambani, I would have operated you today evening, because signing $1 million checks, if you make a mistake in the signature, the government will fall. So then I tell him that, however, if you're Mukesh Ambani's mother who reads the Gita in big print, she can easily read. I won't operate her for 5 years. So I've put him at ease. I've used humor. It has been subtle. I've told him that most patients are between Mukesh Ambani's mother and Mukesh Ambani. And you can choose whenever you want, whenever it disturbs you, we'll operate you. Will you be doing my surgery by laser? Or you will be doing my surgery by laser? No, that is a question. So you don't have femto, you don't have robotic, all that, this thing. So what do you tell him? You tell him that almost all surgeries in the world are done by a process called phacoemulsification. But because the word is very long, and many people trip over the pronunciation, they don't use such long words to scare you. They use simple words like laser. I will be doing exactly what the person who says that they are doing by laser. That is, I will be without any stitches. In a short span of time, your cataract will be out and a lens will be in. You're not telling him any lie. You're just telling him that you're downplaying the laser part. It's of course different if you have a femto. Which IOL is best? Doctor, which IOL is best? So I tell them that if you go to a restaurant and you choose black dal or yellow dal, you know which is best because you've tasted both. But here, first of all, I tell them about monofocal and multifocal. So that argument is, you want to wear glasses, you don't want to wear glasses type of thing. After that, they ask me which brand and all that. So 95% of my patients don't know which brand of lens I'm putting in till they get the sticker. So I tell them that you leave that decision to me, because you are not the expert. Unlike the black dal, yellow dal, I am the expert who will decide what is best for your eye, and I will put it in. So in my mind is his budget. I'm going to play with the budget. I've told him a particular budget. He says, no, I've reduced it by 20,000 rupees. In my mind, I've downgraded his lens. But that's not discussed with him. I'm not giving him package A, B, C, D, E to choose from, because he cannot choose. How does he choose between the two? He doesn't know what is aspheric and all that. It's too difficult even for a counselor to explain. So I tell them, you leave it to me, and usually they do. You will use drops anesthesia only. Now the problem, unfortunately, I'm again white bearded. I use only peribulbous. So I get this question. You will use, because they know that somebody down the street uses drops anesthesia. So how do you counter that? Again, with a little bit of humor, I said, if you like, we can definitely do it with drops anesthesia. I have done a few, which is correct. And the only thing is that my blood pressure goes up by about 20 to 30. Your blood pressure will go up. Also, if anything goes wrong during the surgery, I will find it so easy to blame you. You didn't look where I told you to look. I told you to look in the light. Are kya kar rahe? Look in the light. Then I raise the voice. She says, no, I don't want anything like that. So then I said, then you leave the anesthesia to me. Of course, this again works only if you're doing peribulb. If you're doing topical, you simply say yes. So questions can be all types. The answers have to be given with a dash of humor. Never lie to the patient, but use humor to get your point across and tell them exactly what you're planning to do. I'll just move into, just to give you a couple of more examples. So glaucoma patient is non-compliant. It's okay, na, if I miss a drop or two. I said, yeah. Occasionally you don't say good morning to your wife. It's fine. But if on a daily basis you stop talking to her, you get problems. So once in a while you miss a dose, it's understandable. But otherwise, you need to be compliant. Otherwise, it's so easy for me to blame you for your loss of sight. And will I go blind? So unless he's got 0.95 cupping and a absolute small VFA, you can tell them that no, if you continue to be compliant and follow my treatment, come regularly, we'll try and see to it that whatever vision you have, we'll preserve for you. Again, there is no cure. Will surgery for glaucoma result in cataract? Better to tell them, yes, it could. But many things will also result in cataract. You will become older. That also can result in cataract. And so on. Retina, the patient comes to you, why do I have, he's almost blaming you for his diabetic retinopathy. I have been under perfect control since 20 years. Why do I have diabetic retinopathy? So you tell them that these things, if you were not under perfect control, you would have got the diabetic retinopathy in 10 years. You've pulled on for 20, which is fantastic. But almost as you grow older, almost everyone will get this. So you need to keep explaining that these capsules, if you're in the habit of prescribing antioxidants, they ask me, will these capsules cure the age-related macular degeneration? I said, no, but it will help the pharma industry. So it's important that you need to help the pharma industry. And they laugh about it. They laugh with me. But then they take the capsules which I prescribe for them. I said, okay, it's everyone needs to make money. I am making my money already. You paid me. Now you need to pay the pharma industry. So is there any treatment in Ayurveda or homeopathy for the retinitis pigmentosa? So I tell them always, it's qualified that I have been trained in allopathy. I know that in allopathy there is no treatment. And we have very rigorous evidence-based medicine. This is not there in other specialties. So they make a lot of claims. You're most welcome to go to them, but do come back to me after 6 months so I can tell you that it's not working. So then they have that smile on the face, because I've conveyed to them that is humbug, but without denigrating the other profession. And again, why is retinal detachment surgery urgent? So I tell them that's because my EMI on my operating surgery equipment, the bank is asking me for that money, so I need to operate you by today evening. So then there's already that laugh and that smile, because obviously I've told them an untruth. Then I tell them that the actual reason is because of this, that you might lose your eyesight and so on. So don't counter with little humor, which is subtle, and then go on to say whatever you want to say. So for lack of time, we'll stop at this. But the idea just to convey that don't be serious, even though their disease is serious. You be a little light, but convey everything and don't lie to patients. Be as close to the truth as possible, but use humor to your advantage. It'll only keep you in good connect with the patients, and they will bring patients to you again. Thank you so much.